Neshtar 1, generic name, drug class, brand name. Generic name, cyproheptadine hydrochloride, drug class. First generation antihistamine, H1 receptor antagonist, antiserotonergic agent, 5-HT2 antagonist, mild anticholinergic. Brand names, Periactin, US, UK, Canada, Saplactin, Practin, Apetamin, India, and other countries. Available under various generics worldwide. Number 2. Definition. Cyproheptadine is a first-generation antihistamine with additional antiserotonin and anticholinergic activity, primarily used to treat allergic conditions and as an appetite stimulant. Because of its serotonin-blocking properties, it is also used in migraine prophylaxis and serotonin syndrome. Number 3. Mechanism of action. H1 receptor antagonist. Blocks histamine 1 receptors, reduces effects of histamine, vasodilation, increased capillary permeability, itching, swelling, nasal congestion. 5-HT2 receptor antagonist, inhibits serotonin at 5-HT2 receptors, helps in appetite stimulation, migraine prophylaxis, and serotonin syndrome management. Anticholinergic effects, inhibits muscarinic receptors, leads to sedation, dry mouth, constipation, blurred vision. Appetite stimulation, likely due to serotonin blockade in the hypothalamus, increasing feeding behavior. Number 4 uses. Treatment of allergic conditions, rhinitis conjunctivitis, urticaria, angioedema, eczema, dermatographism. Appetite stimulant in patients with anorexia, malnutrition, cachexia, e.g. in cancer, chronic illness. Migraine prophylaxis, off-label. Serotonin syndrome as an adjunct treatment. Cushing's syndrome, rare, adjunct therapy to reduce cortisol. Number 5. Indications, allergic rhinitis, seasonal perennial. Vasomotor rhinitis, mild urticaria and angioedema, allergic conjunctivitis due to inhalants, foods, atopic dermatitis, contact dermatitis, eczema, appetite loss and weight gain promotion off-label, migraine prevention off-label, serotonin syndrome off-label. 6. Contraindications, hypersensitivity to cyproheptadine or excipients, newborns and premature infants, risk of respiratory depression. Nursing mothers may pass into breast milk and cause sedation in infant, narrow-angle glaucoma, stenosing peptic ulcer, bladder neck obstruction, prostatic hypertrophy, pyloroduodenal obstruction, asthma attacks, acute phase. Number 7. Before taking this medicine, precautions. Elderly, more prone to confusion, dizziness, and sedation. Children may experience paradoxical excitation, irritability, or insomnia instead of sedation. Pregnancy, safety not well established, use only if clearly needed. Lactation, contraindicated, sedation in infant, possible reduced milk production. Comorbid conditions, asthma, can thicken bronchial secretions, glaucoma, risk of increased intraocular pressure, peptic ulcer, prostatic hypertrophy, urinary retention, liver or kidney disease, dose adjustment may be required. Avoid alcohol and other CNS depressants, increase drowsiness. Avoid exposure to extreme heat, drug may decrease sweating, heat stroke risk. 8. How to use. Oral administration, tablet or syrup. Take with or without food. Must be taken at the same time daily for best effect. Do not crush or chew extended release forms if available. Number 9. Dosing information. Adults, allergic conditions, 4 mg every 8 hours, range 12 to 20 mg per day, max 32 mg per day. Appetite stimulant, 2 to 4 mg 2 to 3 times daily, titrated depending on response. Migraine prophylaxis, 4 mg up to 3 times day, max 16 to 20 mg per day. Children, 2 to 6 years, 2 mg every 8 to 12 hours, max 12 mg per day. 7 to 14 years, 4 mg every 8 to 12 hours, max 16 mg per day. 2 years, contraindicated. Number 10. Missed dose and overdose. Missed dose, take as soon as remembered. If near next scheduled dose, skip the missed one. Do not double up. Overdose, symptoms, extreme drowsiness, confusion, hallucinations, dry mouth, flushed face, dilated pupils, tachycardia, tremors, seizures, coma, respiratory depression. Management, supportive care, gastric lavage, activated charcoal, benzodiazepines for seizures, IV fluids, monitoring vitals. Number 11. Stop or avoid taking. If you experience severe allergic reaction, rash, swelling, difficulty breathing. You develop severe confusion, hallucinations, or seizures. If prescribed for weight gain, stop when target weight is achieved to avoid obesity. If instructed by physician due to worsening comorbid condition, e.g. glaucoma, urinary retention. 12. Side effects. Common, drowsiness, sedation, fatigue, dizziness, confusion, SB elderly, dry mouth, blurred vision, constipation, weight gain, increased appetite. Less common, nausea, vomiting, nervousness, irritability, children. Photosensitivity, serious, rare, seizures, hallucinations, psychosis, difficulty urinating, tachycardia, arrhythmias, severe allergic reaction, anaphylaxis. Number 13, vital information. Causes sedation. Avoid driving, operating machinery, or alcohol. Do not use in infants or breastfeeding mothers. May cause significant weight gain. Caution in obese patients. Monitor children closely for paradoxical reactions, hyperactivity instead of sedation. Should not be combined with other antihistamines or appetite stimulants unless prescribed. Number 14, drug interactions, other drugs that affect cyproheptadine. Increased sedation, CNS depressants, alcohol, benzodiazepines, diazepam, lorazepam, opioids, morphine, codeine, tramadol, barbiturates, hypnotics, sleep aids, increased anticholinergic effects, tricyclic antidepressants, amitriptyline, imipramine, antipsychotics, chlorpromazine, clozapine, anti-Parkinson drugs, benztropine, atropine, scopolamine, other interactions. MAO inhibitors, phenelzine, selegiline, intensifies anticholinergic and CNS effects, contraindicated. SSRIs, sertraline, fluoxetine, paroxetine may reduce antidepressant efficacy due to serotonin antagonism. Antihypertensives may enhance hypotensive effect. Thank you. Have a nice day. Thank you. Have a nice day.